Hi everyone, my name is Nandha Menon. I'm a junior majoring in kinesiology and minoring in biochemistry, and I'm on the pre-dental track, which is why I chose to present on the often overlooked connection between oral health and systemic health. We tend to think of dentistry as something separate from medicine that only has to do with teeth, but the reality is the mouth is deeply connected to the rest of the body. Throughout this presentation, I'll explore how oral health impacts everything from heart disease and Alzheimer's to pregnancy outcomes and surgical success. I was inspired to research how interconnected oral health is to systemic health by my experience shadowing and assisting Dr. Modeste at Old Town Medical and Dental Center this year, which is a nonprofit health clinic in Williamsburg that serves uninsured and medically underserved residents. Their mission is to provide high-quality, affordable care to everyone, regardless of their ability to pay. As a dental assistant, I helped with extractions, fillings, crown preparations, sterilization, and filing charts. Pictured to the right is a typical setup I would prepare, and to the left is a picture of me assisting at Old Town's annual Give Kids a Smile event, which provides free dental services to uninsured children. While working under Dr. Modeste, I saw how oral care decisions are tied to a patient's entire medical background. He emphasized the importance of understanding not just the mouth, but the full picture, including a patient's medications, medical history, and even their mental health and any potential dental anxiety. Old Town's model of interdisciplinary care and extensive collaboration with other healthcare professionals reinforced everything I'm going to talk about today. So why don't people take oral health as seriously as general health? It could be because historically, dentistry and medicine split paths when dental schools were established separately from medical schools. And dental insurance didn't even exist until decades after medical insurance, and when it did arrive, it was limited in coverage. To this day, dental care is viewed more like a benefit than a necessity, and Medicare doesn't include it most of the times. This institutional lack of priority has created a huge gap in awareness, and many patients still think teeth only matter for appearance, not for overall health. This neglect comes at a cost, however. $1 billion is spent each year alleviating preventable dental-related pain in emergency departments. Meanwhile, preventative dental care in high-risk groups like diabetics or stroke survivors saves over $1,000 per person per year. Even basic dental screenings for systemic conditions save over $20 per patient. Such dental screenings exist because a lot of conditions like diabetes, for example, show physical signs in the oral cavity, which is why procedures like HbA1c testing for blood glucose is becoming more common in dental clinics. But this connection is not well known amongst the patient population. These statistics show how oral health isn't just about cavities, it's about keeping the entire body healthier and saving money while we do it. One of the clearest examples of this connection is dental clearance, which is required before many major procedures like joint implants or heart surgeries. Clearance means removing oral infections to reduce the risk of bacteria spreading during or after surgery. Actually, in a recent study surveying patients in need of endoprosthesis implantation, only 35% of patients were even aware that oral health could affect surgical outcomes because of the ability of oral bacteria to spread throughout the body and colonize. What's worse is that over 90% of orthopedic clinics in charge of these patients knew about this link, but only 14% had active partnerships with dental providers. That breakdown in communication delays treatment and puts patients at risk, highlighting a serious issue in the healthcare system. Dental clearance can't happen in one visit. It takes time and maintenance, which is why regular care is so important. Some other links to systemic health include eye health. Studies have actually found a correlation between gum disease and optic nerve damage, and Alzheimer's, which was revealed when bacteria from gingivitis were found in Alzheimer's brain tissue. The bacteria triggers inflammation that accelerates neurodegeneration. It even affects pregnancy, as oral pathogens can actually colonize the placenta, causing inflammation and contributing to preterm birth or even fetal death. These findings are pretty sobering. They show that oral bacteria aren't just local. They move throughout the body and can impact multiple body processes and life stages. So how do we fix this gap between oral and systemic care? First, dual degree programs like a DDS combined with Masters in Public Health or clinical research have been shown to improve dentists' clinical performance by giving dental students education that provides insight into systemic health. Second would be increasing efforts to educate the patient population either through organized events or while the patients are in the chair. If patients were to know how interconnected dental and overall health is, they may be more likely to put more effort on their ends to maintain a good oral hygiene routine. Third is collaboration. Medical and dental professionals need to work together more closely, sharing records, making referrals, and treating the full person. And finally, we can expand screenings. Many dentists are now using HbA1c testing and imaging tools to spot systemic disease risk during a regular checkup. To wrap up, oral health is systemic health. There's a significant amount of evidence to prove that what happens in the mouth affects the brain, heart, joints, pregnancy, and more. And if there was more awareness raised about these connections, we could finally start to bridge the gap between dentistry and medicine. My experience at Old Town solidified this perspective. I saw firsthand the impacts of various procedures and patients cleared for life-changing surgeries or treatments after proper dental care. Moving forward, we need more collaboration, better education, and a healthcare system that sees the mouth as a part of the body and a window to it, not separate from it. And these are my references. I hope this presentation effectively highlighted how interconnected oral health and general health care are, and that it brings us one step closer to bridging the gap between dentistry and medicine. Thank you for listening.